Welcome to the Burnaid channel. Thank you for joining us. In this comprehensive guide, we'll explore the influenza virus, commonly known as the flu. We'll discuss its duration, symptoms, treatment options, and prevention strategies to help you better understand and manage this common but potentially serious illness. Understanding the flu. The flu, or influenza, is a highly contagious viral infection that primarily affects the respiratory system. Key points include: 1. Causative agent, influenza viruses A, B, and C. 2. Transmission, primarily through respiratory droplets when infected individuals cough, sneeze, or talk. 3. Incubation period, typically 1 to 4 days after exposure. 4. Seasonality, most common during fall and winter months in temperate climates. 5. Pandemic potential, some strains can cause global outbreaks. Duration of the flu. The course of the flu can vary, but typically follows this pattern: 1. Onset, symptoms often appear suddenly. 2. Peak severity, the most severe symptoms usually occur during the first 3 to 4 days. 3. Total duration, most cases last about 5 to 7 days. 4. Extended symptoms, some symptoms like fatigue and cough may persist for 2 weeks or more. 5. Variations, children, elderly, and immunocompromised individuals may experience longer durations. 6. Complications, in some cases, complications can extend the illness duration significantly. Symptoms of the flu. Flu symptoms can range from mild to severe and may include: 1. Respiratory symptoms, dry, persistent cough, sore throat, runny or stuffy nose. 2. Systemic symptoms, high fever, usually 100 degrees Fahrenheit to 104 degrees Fahrenheit, chills and sweats, fatigue and weakness, muscle aches and body pains. 3. Other common symptoms, headache, loss of appetite. 4. Gastrointestinal symptoms, more common in children, nausea, vomiting, diarrhea. 5. Symptom progression, symptoms may change or evolve over the course of the illness. Stages of flu recovery. The recovery process typically follows these stages: 1. Days 1 to 3, onset of symptoms, often sudden and severe. 2. Days 4 to 7, peak of symptoms, gradual improvement begins. 3. Days 8 to 10, most symptoms subside, but fatigue may persist. 4. Days 11 to 14, return to normal activities, some residual symptoms may linger. 5. Beyond 2 weeks, full recovery for most, but some may experience post-viral fatigue. Treatment options. While there's no cure for the flu, several treatment approaches can help manage symptoms and speed recovery. 1. Antiviral medications, oseltamivir, Tamiflu, zanamivir, Relenza, baloxavir marboxil, Cofloza. 2. Over-the-counter medications, acetaminophen or ibuprofen for fever and pain, decongestants for nasal congestion, cough suppressants or expectorants. 3. Home remedies, rest and sleep, staying hydrated, warm salt water gargles for sore throat, honey for cough, not for children under 1 year. 4. Supportive care. Treatment options. Using a humidifier, eating nutrient-rich foods, avoiding alcohol and tobacco. When to seek medical attention. Consult a healthcare provider if you experience: 1. Persistent high fever, above 103 degrees Fahrenheit or any fever lasting more than 3 days. 2. Difficulty breathing or shortness of breath. 3. Chest pain or pressure. 4. Sudden dizziness or confusion. 5. Severe or persistent vomiting. 6. Flu-like symptoms that improve but then return with fever and worse cough. 7. Worsening of chronic medical conditions. High-risk groups, elderly, young children, pregnant women, immunocompromised individuals, should seek medical care early in the course of illness. Complications of the flu. While most people recover fully, the flu can lead to serious complications, including 1. Pneumonia, bacterial or viral. 2. Myocarditis, inflammation of the heart muscle. 3. Encephalitis, inflammation of the brain. 4. Myositis, inflammation of the muscles. 5. Multi-organ failure, example respiratory and kidney failure. 6. Worsening of chronic medical problems. Prevention strategies. Preventing the flu involves multiple approaches. 1. Vaccination. Annual flu vaccine is the most effective prevention method, recommended for everyone 6 months and older. 2. Hygiene practices, regular hand washing with soap and water, using alcohol-based hand sanitizers when soap isn't available, avoiding touching your face, especially your mouth, nose, and eyes. 3. Social measures, avoiding close contact with sick individuals, staying home when you're sick to prevent spreading the virus, covering your mouth and nose when coughing or sneezing. 4. Prevention strategies. Environmental measures, regular cleaning and disinfecting of frequently touched surfaces, maintaining good ventilation in indoor spaces. 5. Healthy lifestyle, getting adequate sleep, eating a balanced diet, regular exercise to boost immune function. Flu versus common cold. While both are respiratory illnesses, they have some key differences. 1. Onset. Flu symptoms typically come on suddenly, while cold symptoms develop gradually. 2. Severity. Flu symptoms are usually more severe than cold symptoms. 3. Fever. High fever is common with flu, rare with colds. 4. Body aches, more severe and common with flu. 5. Complications. Flu is more likely to result in serious complications. 6. Duration. Colds typically resolve more quickly than the flu. Important notice. This presentation is for informational purposes only and should not be considered medical advice. Always consult with a healthcare professional for proper diagnosis and treatment. For answers to over 3,000 health-related questions, download the Burn8 app for free from the Play Store or App Store.